Bellin came to Nordic with a long history of working with Nordic to implement projects with them, and they came to Nordic with a really special project. So the Green Bay area has a couple of clinics that serve the homeless and working poor in the community, and Bellin, in conjunction with some other hospitals in Green Bay, have been providing care and support to both patients coming out of these clinics and to the clinics themselves. Bellin wanted to really step up its game in terms of helping the community and came to Nordic and said, we want to bring these clinics up on our version of Epic for a couple of different reasons.
We had 3 different clinics that we were going to bring up simultaneously. Each one was very different. One was a clinic for the homeless, and so we went to different homeless shelters. We had to be able to set up in gyms, and we had to have our equipment being able to do all of that. We had one clinic that had a lot of walk-ins, so we had 25 to 30 volunteer doctors at any given time coming into that clinic. Many of them retired, so had limited computer skills. And then we had a clinic that we had at a technical college. And so the one at the technical college, we had to integrate with their web-based systems and their system as well.
Patient safety and continuity of care are top priorities in the outreach healthcare program. We work with patients that see other providers in Green Bay. They are frequently seen in the emergency department. One of the limitations of a paper charting system is that at times we don't get those records in a timely manner, and that can make it more difficult for us to continue treatment or get patients the medications that they need.
Sometimes with our homeless, it's very difficult as they don't really have a primary care doctor, so going to the emergency is basically the only way for them to get access to health care. So as we've known that if they went to the emergencies, it gives us a better view that they've done this, and then we can pick it up from the emergency visits and help them to the next point.
During the implementation of our electronic medical record system, the Nordic team was very involved with us in meeting our program's needs. They helped us to really customize the EMR to be serviceable at all of our clinical sites. We track a significant amount of clinical data that we're required to report to the federal government and also to other program funders, so they helped us to customize queries and fields so that we can make sure that we're providing excellent clinical care, but also so that the records across multiple sites were coordinated.
They never looked at a challenge as a negative. They looked at the challenges as positives and a way to make our clinic a better place for our clients.
Since we have implemented Epic with the help of Nordic, it has been a tremendous benefit to our clinical operations and to patient care. We've improved our access to records from other providers, from emergency departments, other clinics. We're able to communicate with them. We're able to get timely medication updates, medical records. It also has made our logistics much easier. We can take a single computer to multiple sites and provide patient care at homeless shelters, at drop-in centers, all of which were challenging prior to implementation of the record.
And it makes us look credible because we are the same as any other clinic. And when people come on in, they know that the care is the same as it would be anywhere else.
I think the thing that I feel the most proud of with the New Community Project is really just seeing Bellin's role in the community. I mean, I grew up in that neighborhood, so I find that so often as an Epic Care analyst, I find myself sitting behind a computer, so it was really cool and rewarding to actually be there in the community and seeing, you know, what we had to offer.
This was really the most meaningful experience I'd ever had doing a project. And from the perspective of someone who's consulting, like that is something that I'm never going to forget.
We felt like we got the best because, you know, they treated us very nicely. They treated us as if we were the best project in the world, and they even fed us at times. And so nobody ever feeds a nonprofit because you don't always feel that you're that important. And they made us feel like we were the most important project in the world.